Hello, my name is Dan Toner. I'm the health insurance broker and agent for Premier Mobile and Common HealthCare. We're going to talk about open enrollment for the June 2023 plan designs. We are offering some new coverages. So I am doing some screen sharing here as well. You'll notice that some couple of key points. The medical renewal with Florida Blue renews on June 1. So we're going to conduct open enrollment from April 27th this week until May 12th. We are using a new portal, an enrollment portal called My Benefit Link. All employees will get an email before the 27th to click on, log in, create an account, and make your elections all by May 12th. If you have not received that link by the 27th of April, please contact Natalie Rodriguez, and I have her email right on the screen, natalie@commonhealthcare.com. She'll work with my team to make sure we get you a link to make your elections. We've created a 31-page memo. Certainly take your time to read it, but I'm going to go over some of the highlights for this presentation. My name is Dan Toner. This is my company. On the last page, this is how you can reach me. Here I am, Dan Toner, and that's my email and phone. Amanda and Leslie are my support staff. Towards the front of the memo, we're introducing the plan will be from June 1 of this year until June 1 of next year. What we are offering is, again, Florida Blue is our existing medical plan. Right now, we have one plan with Florida Blue called the Silver Plan. We are offering a Gold Plan for those of you that want to pay a little extra to Florida Blue, and we're going to go over some of those details and comparisons in a few minutes. And we're really excited about offering brand new coverages, voluntary, non-medical, which is life insurance, dental, vision, and short-term disability, all from the principal. So again, super important that you log in and make your elections. You can enroll under medical and waive dental. You can be a family on vision and waive all the other coverages. They're all different from each other, so one does not have anything to do with the other. So certainly make sure you go through each screen, which I'm going to go over with you in a few minutes. So little details about the medical prescription plan. Florida Blue, you do need to pick a primary care. If you do not pick one, Florida Blue will pick one for you, and then no worries, you can call customer service the second the plan starts and simply change your primary care. You also don't need a referral from that primary to see specialists. Some reminders, the value choice benefits are like a clinic from the Sanitas Clinic. And if you see the value choice providers, you will get a lower copay, richer coverage, but you don't have to see them, obviously. And a little bit of information about the pharmacy. And you can see right on the screen, you can click on tools and look at the preferred pharmacies like Walgreens, Walmart, Publix, Winn-Dixie. You don't have to go to those, but there's some special discounts. So take a peek and pay attention to that as well. This is a little comparison with the two side by side. This is the existing plan. Now, the deductible last year was a little less than $3,200, and they bumped it up to $3,200. The good news is the deductible doesn't apply to many of the services. And when you'll see in the memo, as we go further on, where the deductible applies. But the existing Silver Plan is one where, remember, if you're choosing a value choice, you'll have a $0 copay. But if you're going to other Florida Blue providers, you'll have a $20 copay when seeking care from your primary. For specialists, there's a $70 copay. And if you're seeing the value choice, it's a $30 copay. The Gold, for example, is an upgrade. And when you look at the portal, it'll show you how much extra it is to upgrade to Gold. And one of the advantages is obviously you'll pay a little lower copays. On the screen, also pay attention to things like emergency room copays, urgent care copays, diagnostic tests and x-rays, medications. So this is all pretty much spelled out in the benefit summaries. And I will tell you that if you continue with this memo, I have included the entire summary plan description for the Simply Blue Silver plan, and a few pages in, you can see the Gold. One of the suggestions I would have for you is the out-of-pocket on the Gold is $5,250, and the maximum out-of-pocket is the sum total of all your deductibles and copays. It is a little higher on the Silver plan, but I will tell you that the Silver plan is richer in a lot of aspects, and I want to give you an example of that. If you go down to the hospital, you will pay a $750 copay per day, and after the third day, you don't owe any more copay of being admitted. Now that's going to go towards your $8,800 out of pocket for the year. But if you're in the hospital for 10 nights or 20 nights or 30 nights, the most you're going to owe per admission is $2,250. So it's going to be really hard to hit the $8,800. And that's an example of where the Silver plan is very good. That $3,200 deductible also does not apply to hospitals and surgery bills. So it does make it very difficult to hit the $8,800. The Silver plan, again, is the most popular plan purchased. The Gold plan is going to have a lower out-of-pocket, but you can see for things like hospital and surgery, you're going to owe a $500 deductible and then 50% of the bill. So up front, that may be worse coverage than the Silver, but the reality is the out-of-pocket is less. And that's an example of where you may want to upgrade the plan. If you think you're going to have a significant amount of hospital stays and surgery stays, because remember what the Silver is doing is charging you per day and per admission. So you can go a couple of times in the spring, a couple of times in the summer, and a couple of times in the fall. And that's an example of why one would meet that $8,800. Whereas the Gold plan is going to tell you your worst case scenario is $5,250. So I hope that helps. If not, please contact me one-on-one. I'd certainly be happy to help you in your personal circumstance and help you make your elections. Okay, but that's a fundamental difference between the Silver and the Gold. I do have a page here on how to look up your doctor and pick your primaries. And again, I've gone over the memo in terms of you can certainly take a peek at the details of the medical Silver and the medical Gold. So Principal is our non-medical carrier. We're offering life insurance where the employees can purchase up to $500,000 worth of life insurance, and you could buy them in increments of $10,000. On our portal, you will simply do a drag and pick the cost for $10,000, $20,000, $100,000, and the software, the portal will show you your per check deductions if you'd like to purchase life insurance. I will tell you that the evidence of insurability is needed for certain amounts of life insurance. That's a health questionnaire. So you're guaranteed up to a certain amount of health insurance without filling the medical questions. And our portal will indicate if you've gone over that evidence of insurability total, you may have to fill out a form to get additional coverage. So for example, if you requested $500,000, you're definitely going to have to fill out an evidence of insurability, but you'll be given the guarantee regardless. Dental is a PPO. You can go to any dentist you want, but there are in-network and out-of-network coverages. Vision has in and out-of-network coverage. Keep in mind one thing about vision. If you have a medical condition, that's going to be covered by your medical plan. But if you're looking for coverage for routine reimbursements for lenses, frames, your annual checkup, you do need to purchase a vision plan that is separate and not covered under medical. And voluntary short-term disability is definitely a needed benefit, where if you get hurt, it's going to pay you up to the first 25 weeks of being disabled. In each benefit, the life insurance, I've actually mentioned these are the details. You can purchase it for spouse and also for children. These are the dental coverages. These are the vision coverages. And if you go into the last, you can see the disability. And by the way, you're getting 60% of your salary up to a maximum of $2,500. That's the max you'll get, but you're getting 60% of your income. The portal does need to see your income. So if you're not seeing an amount, it could be that Natalie and I did not put in your salary. Just contact us. We'll put in your salary, and then you can log back in and make your elections. So that's the short-term disability. And then more importantly, I've given towards the end my benefit link. So you'll simply get an email, Common HealthCare. You'll start your registration. You'll pick your update your profile, add your dependents. Definitely add your dependents if you have them. And when you get to each screen, you can make a decision if you want to cover yourself as a single or add them. So you can't add, you can't see costs for dependents unless you add them on step 3. When you go to step 4, this is a little example of what you'll see. You'll see the 2 medical plans, the silver and the blue. You can click info to get more details. You can compare them side by side. You will click select to get started and either waive or enroll under coverage. Once you make your election for medical, you'll move down to dental, life, vision, and the short-term disability. Again, click modify and enroll or decline. And then when you're finished with all items, you'll get a congratulations, you've successfully enrolled. Natalie and my team will get an email confirmation. And by the 12th, we're going to wrap that up and send a file over to Florida Blue and principal, letting them know who's elected which coverage. Again, as a contact, my name, Dan Toner, is at the end of this memo. I've given you some important links. My benefit link is our portal. Florida Blue is your medical carrier. Principal is your non-medical. And I've given you some customer service phone numbers and claims addresses as some additional information. So I look forward to helping you throughout the year navigate through the daily health insurance needs and questions and concerns. And certainly we work with Florida Blue. Any questions that you're having during the year, try your insurance company first, Florida Blue for any medical or prescription questions or claim issues, or principal. And if you're having problems, definitely come to my team at FFP. We want to help you and Natalie and all the fine folks at Common HealthCare during the year with the health insurance. Thanks. Have a great day, a great spring, and a great summer.